So I think we're ready to get going, and for me to sort of talk to you a little bit about, again, sort of why athenaOne. And I've sort of come up with four things that are, these are not all being, if you will, these are not all the reasons, but to me, four biggest things that are really going on in the industry, going on in healthcare, that are super impactful to organizations like yours, and are a lot of the reasons, in addition, that groups are looking to move to athenaOne. So the first is, you think about all the bolt-ons you need these days, right? There's so many different things. Your needs as an organization have grown and evolved so much with the market, et cetera, that there's so many different things that you need to buy and maintain, right? Different third-party applications. Some of them you may actually buy through us. Some of them you may buy elsewhere. But all of them have to interface together. They have to work together. You have to coordinate all that, and you have to pay for it as well, too. And those things sort of keep stacking up on top of each other and are a bit of a challenge, I think, to many organizations. Similarly, there's a lot of manual work out there. I like to joke that, the 80s called and want their fax machine back, right? But in healthcare, we are still firmly in the 80s when it comes to things like fax machines and so much manual work that happens within groups today. So it is a huge challenge, both from the ability to deliver great care, but also to grow and be profitable in your business. And it also contributes to the third item here, which is burnout. We've been hearing about burnout in practices for so long, be it providers or staff, right? And let's be clear, let's be very honest with each other. One of the big things, the top of the list of what providers in particular talk about with burnout is EMR, right? It's their challenge with an EMR that makes their jobs more difficult, and more of that manual work as well, too. And then lastly, you all are getting squeezed in multiple directions. You're getting downward pressure on reimbursements. You're getting upward pressure on costs with inflation. And the whole COVID staffing thing, it's still there, right? You're still challenged with keeping your staff on board and keeping good staff on board. So these are the four things that I think of that are big factors in the market right now. And again, a lot of the reasons why folks come to look to athenaOne. And so let's dig into that just a little bit more here. So this slide, please don't try to look at every single thing on this slide. This is meant to just be a visual type of thing to talk about the fact that when you think about your world today with Athena Practice, there are lots of additional bolt-on things that you need to buy and to manage, right? And in the athenaOne world, those are both, by the way, products and services that you need to procure. And in the athenaOne world, most of those things are part of athenaOne. They're part of the service that we provide, whether it's the technology components, services, or even products. Even things like patient statements, as an example, are part of the service that's provided within athenaOne. So this idea that you have it all in one place with one vendor, one solution to manage and keep a lot more cost effective is a big driver for organizations looking to consolidate all those different add-on solutions. Now, there's three obviously different components to athenaOne. And so in ways that we drive, optimal efficiency. So revenue cycle obviously is not only just the practice management component we call collector, but there's also services on top of that you can procure. So you could add things like authorization management or coding, et cetera, et cetera. And a lot of this goes to the concept of what we talk about as comparative advantage. This whole idea that you think about your organization, you think about your mission or vision statements are what's really important to you as an organization, right? And there's lots of things you have to do every day that don't go to anything about that mission or vision, right? There's things like posting payments or scanning documents or a number of things that are not core to who you are and why you deliver the best service and best value to your patients, right? So this concept of comparative advantages, have someone like athenaOne take over some of that work by automating some of it as well too, so you can focus on the higher value things. So we do that throughout, but certainly revenue cycle is one area for sure. From a clinical experience point of view, obviously there's the EMR, and you're going to see that today. But it's also, you're going to see today our ambient solution as an example. So when we talk about that burnout that providers are having, this is a tool that's going to wow you in the ability to get the doc's noses out of the screen as much as possible, right? And have them really focusing on the patient. And then patient engagement is incredibly important, right? Patient engagement is what keeps your patients stickier. And let's be honest, they're not just patients, they're consumers. And so they're looking for consumer grade type of application for you to keep them sort of engaged. How they do business, how we all do business in sort of every part of our lives today. So let's dig into a couple of those just a little bit more. From a clinical point of view, from a documentation point of view, we've got a couple things going on here. Seamlessly exchanging patient records is one thing for sure that Athena does really better than anybody. We've been so focused on this from day one, how important it is that not everybody's going to be on Athena, right? So the ability to exchange records with all different types of entities is really core to what we're doing. Accelerating documentation. I mentioned the ambient solution, but even beyond that, think about our business model for a second, too. Those of you who are familiar with this whole concept of what we call aligned incentives. So this aligned incentives concept, some of you may think of it around revenue cycle a little bit more. But if you think about it from a clinical point of view, if we're able to help you accelerate documentation, to see more patients, to have your providers happier, you're going to be more successful and we're going to be more successful too, right? So think about it in terms of those perspective as well. And then easily informing care, having information at the point of care, especially from a value-based care point of view. And then, as I mentioned, consumers, patients/consumers expect, I'm trying to find my phone here. They expect, she's got her phone. They expect us to be, they expect to use these in so many different ways, whether it's ordering food or getting a flight or doing your banking or whatever it is. They use technology to interact with all parts of their life. And as you see on the screen here in this study, fully a quarter of patients surveyed said, hey, if I can't get that kind of engagement from my provider, I'm going to go elsewhere for it. So it's really, really important that you have a full strategy around patient engagement. And athenaOne helps enable that. And as I said, these are truly consumers, not just patients. And what it allows us to do when you have a really good patient experience, it makes those patients stickier, right? They're going to be more likely to stay with you if they've got a way to interact with you electronically and in a meaningful way that they're going to stay with you. You can use that tool to drive better results within your practice too. And I'm talking about clinical results as well. You're doing things like campaigns, identifying all, folks over 50 that haven't, had certain procedures done, colonoscopy, for instance, in X period of time, right? And being able to get information out to them and get them booked, et cetera, and giving them the tools to do that. And you're going to get paid more as well, too. And we can show this through the tools that we use because we're on this network, right? And we can measure things and see how we're doing. And we do things like A/B testing, where we try different messaging to say, hey, how does this work? How does that work in this audience? Which works better? And how do we pivot to ensure that we're going to get the best results? So all these things are fundamental to keeping patients engaged and healthier, and you getting paid more as well, too. All right. And then last slide before I turn things over to Dr. Clark is just, as I said in the beginning, it's incredibly important to us that you are all customers today, and we value that. And because we value that so much, we put together programs to give you the most favorable pricing that we can. We give you, if you look to move to athenaOne, we'll put a deal on the table that is below market and wouldn't be given to any other organization that isn't a customer, that isn't a current Athena practice customer. So we give a lower rate. We'll also try to do everything we can to lower the upfront fees. Moving from one EMR to another is a big deal on a lot of levels, operationally and financially as well, too. So we're going to do everything we can to limit the burden financially of you making that move over to athenaOne. And then lastly, because we've done this so many times, we've done this almost 400 times now, Athena practice customer moving to athenaOne, we've gotten really good at it. And we've gotten really good at moving the data over as well, so that we can do that in a much more automated way that doesn't involve you, doesn't take as much time out of your day as well, too, to make that move over to athenaOne.